You're all very welcome today. We're going to start promptly. We've quite a few people have already joined us. We do know that there are some more coming, but we're going to kick off just to keep us all on the right time track. So my name's Frances Walsh and I'm PlayBoard's Regional Coordinator for School Age Childcare. And also present from PlayBoard today is one of the project officers from the School Age Childcare team, Pauline Murray. We are aware that there are providers from daycare, playgroup, standalone after school care and some childminders with us today, and we thank you all for being present, but I must point out that this presentation is based on the guidance for registered group childcare settings version 4. A different set of guidelines exists for childminders. However, that being said, the key principles of the message that we're given today can be tweaked and applied where relevant to your own setting. Just a word on how this session is being managed today. The webinar is being recorded, and so we've switched off your camera access for GDPR purposes, and we've muted your microphones to reduce any potential background noise. You'll be able to see the presentation, and we ask you to submit any questions that you might have via the typed chat feature there at the bottom of your screen. It looks like a small speech bubble. You can go in there, you can type questions, and they will come through to us. So you can type questions as we go through the presentation, and I'll do my best to answer them once I've taken you through the slides. Okay. So COVID-19, what is it and why do we need to complete a risk assessment for it? COVID-19 is it's a new illness, and it can affect the lungs and the airways. It's caused by a virus called coronavirus, and symptoms can be mild, moderate, severe, or fatal. So that being said, why do we need to complete a risk assessment? So it's a prerequisite to the Health and Social Care Trust approving the reopening of childcare settings. To increase the awareness of risks posed by COVID-19 so we can inhibit the spread, and to keep staff, children, parents, suppliers, anybody who's using your building, to keep them safe from contracting the virus, thus becoming ill and potentially causing death. There's an element to risk in everything that we do, and working with children, we encourage the use of risk-benefit model, as there are benefits to be had from allowing children to take certain managed risks. The risk assessment we're going to discuss in the context of COVID-19 is the conventional model. You need to remember that a COVID-19 risk assessment doesn't replace the need for you to conduct normal risk assessment to prevent trips and falls and the normal procedures that you would go through. So with all of the hype and the fear that has been around for the past 5 months, and with all of the deaths that have been reported, if I'm going to entrust my son to your care, I need to be reassured that you're taking every precaution to keep him safe. So sharing your risk assessment once it's completed with the parents is one way to do that, to assure them that you're taking all the necessary precautions to keep mine and everybody else's child safe. So where do I start? Okay, so the guidance that has been published by the Department of Health, which is currently guidance version number 4. That's your rule book. You need to familiarize yourself with all of its content, and you need to give the document to your staff to read as well and to make sure they do. You need to take them through it so that everybody's on the same page. Sometimes if people understand why they're having to put these additional layers and measures in place, when they understand why, when they see where it's coming from, it can help them to be more compliant in doing so. The Public Health Agency, their website has the official health information on COVID-19, but it's also useful because it has some posters for downloading, and it'll help. Those posters will help keep the awareness raised amongst your staff. The Health and Social Care Trust, they'll want to see the guidance implemented, but they also ask for a risk assessment to be completed as part of their endorsement for you to open. So you need to let your local Health and Social Care Trust know of your intention to open. That's really your first step, because they have to endorse that reopening as such. Policy procedure review. Without doubt, some of your policies will have to be reviewed and changed as a result of COVID-19. Policies such as the arrival and departure of children, because you need to comply with social distancing, so you need to revisit that policy. Things like your fee payments policy, again, social distancing, the handling of money, and certainly you'll have to review your infectious diseases policy. The changes you plan to make to your procedures, they can likely be reflected within your actual risk assessment. You can use the policy to review and feed into what you need to take account of in managing risk, and vice versa. One will likely reflect in the other. Consultation with your board. Risk assessment should be led by the board, but also consultation with your staff and your parents. You need to find out from your parents what their actual concerns are so that you can make sure that you cover that in your assessment. Again, it's having that reassurance that they feel safe to place their child into your care. Find out what kind of experience that their children had in lockdown. Are the kids fearful of germs that they've heard about? Can you add in measures to help ease those fears? Consider doing a walk around your actual premises, walk around the building, and you want to be looking for places where you need to put controls in place. For example, the staff kitchen or the staff room, the photocopier, the printer, those common areas where people can gather. Basically, going into this, you want to adopt a balanced approach. You need to think about sensible measures to manage health and safety risks in your actual workplace. Okay, so what should I include in my risk assessment? What I've done here is to show you some of the headings that you might want to consider in actually assessing the risk. So what are the hazards? A hazard is anything that can cause harm. And in this case, we are focusing on COVID-19. We want to reduce the spread of COVID-19 because it can cause potential serious illness and potential death. So who might be harmed? Okay, so staff, parents, children, visitors, you know, the person who refills your water supplies, anybody who's making a delivery to your setting. Royal Mail, anyone physically entering the building or coming into contact with your staff in your normal day-to-day practice. So when you're doing the risk assessment, you're trying to assess the risk to those people as well as to your children and to your staff on site. And therefore you need to put the measures in place that will protect everybody equally. So the controls required. So once you've decided on the hazard and who might be harmed, you have to develop your plan on what you're going to do to minimize the risk. You must do everything that's reasonably practical to protect everyone from harm. The controls are the measures you're going to put in place to manage the actual risk and minimize the hazard of spreading COVID-19. So these are some of the headings, some of the things that you will need to review within your setting and implement safeguards to control the risk. Things like you'll need to consider hand washing, you'll need to consider cleaning of the premises, social distancing, wearing gloves, potentially PPE, transport, outdoor play space, staff areas, symptoms of COVID-19 where they appear or a confirmed case. These are the kinds of things that you're going to use as your headings and put in the measures that you need to actually control them. I will break down some of these as we go forward on the next slide. And then we have the additional controls. So the additional controls basically are what else needs to happen to make sure the risk is minimized? Is there an additional layer of protection that you can apply? And again, I'll take you through some of what that might look like in the next slide. Okay, so I've taken one of those headings in terms of hand washing. Now, the Department of Health and the Public Health Agency, their guidance states that we need to wash our hands thoroughly, and that doing this regularly will help reduce the spread of COVID-19. So how do you comply with that in a childcare setting? What measures can you put in place? So let's look at some of the controls required. Pretty self-explanatory, but so you would want to have sufficient supplies of soap, water, paper towels available for both your adults and your children. And I think it's important to remember when we're doing this that although the children are our focus, we also need to remember that we do have staff in place and that our controls have to reach out to them as well. Strict hand washing should be taking place. You should be using disposable paper towels for drying wet hands. There's evidence to show that this is more effective than the actual the hand dryers that are on the wall, and certainly better than the cloth towels in terms of cross-infection. You'd want to be providing bins to dispose of used paper towels. You would want to be introducing gel hand sanitizers for areas where washing facilities aren't readily available. For example, at the entrance to the premises, actually in the office, or in the outside play area. And you'd want to be providing tissues for adult and children's use. We've heard of the catch it, bin it, kill it. So in order to comply with that, you likely want to put boxes of tissues where the adults and the children can access them. And if you're doing that, then obviously you need to provide covered waste bins for those used tissues. So if we put those in place, the question is that enough? What else can you do to enhance the practice of hand washing and maintain good hygiene? So let's look at some of the additional controls. Okay, so we've said there about having sufficient supplies of soap, water, paper towels. But an additional control would be that the manager would perform weekly checks and maintain supplies. Because we're all being asked now to wash our hands more regularly, you're going to go through your supplies more quickly, and you need to bear that in mind, that those supplies are going to need to be replenished potentially more frequently. So the manager might perform those weekly checks just to make sure that everything's of a good level and that there's enough of the supplies in place. Part of the additional controls is that staff are going to be reminded of proper hand washing techniques, 20 seconds. Staff are going to perform checks, ensuring bins are not left overflowing at any point. Because again, if everybody's going to be washing their hands more frequently, using paper towels, then those bins are going to fill up pretty regularly. So you need to appoint someone to keep a wee eye on that, because you do not want soiled disposable paper towels lying on the ground or having them overflowing where children can touch them. Staff will support children in washing their hands or using hand gel at regular stages throughout the day, because especially some of your younger children who might have trouble cleaning their hands independently. And in the guidance, it does talk about some of the songs and the games that you can introduce to actually do that with children, to support the children in your care. Going back to the tissues, staff will be reminded and children supported to catch coughs and sneezes in tissues and of the correct disposal. And there is an element then, because we're saying about staff being reminded, there's an element here for the leader, for the manager, to ensure that staff are aware of what their responsibilities are. You might want to put up posters from the Public Health Agency's website, or Family Support NI have some posters on there as well. Catch it, bin it, kill it, or there are posters available for that show you how to wash your hands properly. Again, with the covered waste bins, you need to be checking that bins will not be left overflowing, but will be empty promptly. And again, who's going to take responsibility for that? Who's going to monitor that these bins are regularly empty, or emptied regularly, and make sure that they know that that's their responsibility, whoever you assign that task to. So some of the general infection safeguards that you would want to be aware of, okay? So resources will not be shared between play pods. Okay, so version 4 of the guidance removes the requirement to operate play pods in a maximum of 12 children. However, the concept remains that you should keep children and adults in consistent groups as far as possible. So if you operate a play group and an after school in the afternoon, those essentially are two different groups. So you shouldn't be sharing the resources between the two, okay? So you need to put measures in place as to how you will address that if that is your actual situation. Toys will be rotated. This is a control that you can put in place. Toys will be rotated, allowing for cleaning to take place on alternate days. Say, for example, you have 20 books, and on a Monday, you're putting out 10 of them. On the Monday evening, you're taking those 10 books away, and you're putting them, wiping down the surface of them and putting them away, kind of quarantining them for the 24 hours. On the Tuesday, you're putting out your other 10 books. And again, that's just, it's a small measure, but one that you can take to try and, again, minimize the risk of spreading COVID-19. Toys will be rotated, allowing for cleaning to take place on alternative days. Same thing. So soft toys and toys which cannot be immersed for cleaning will be removed. Anything with an intricate part, like toys that would have batteries, things that would prevent them from actually being immersed in water, you might want to consider actually removing from the play setting as such. Bean bags will be removed from the playroom. The guidance recommends that bean bags, cushions, and soft furnishings are removed because there's a greater risk of cross-infection there. So you might want to do a scan of your room, and you want to take those types of things out of play, basically. Children will be discouraged from bringing toys or personal items from home. Okay, so again, that's a measure that you can take, but one kind of caveat to that is if a child is particularly nervous about coming back to the setting and there is emotional value in that child bringing a toy to help the transition, then you can use common sense and allow that to actually come into the room. But I'll talk about that in addition, under additional controls, what you can do to put an additional measure in there to safeguard that. You basically don't want to make a child who's anxious about returning feel even worse by taking their wee comfort toy off them. Okay, so you might want to increase your outdoor activities. The guidance talks very clearly about how that's a recommendation, because once you're outside, obviously you have the free flowing air and you can introduce social distancing measures much more easily. And then where possible, windows will be open to allow for ventilation of the playroom. That's another measure that you can put in place. Think about somebody that has flu or sick. What do? You go in and you open the windows, you let the fresh air get in to circulate. That's what you're talking about doing there. Staff will be familiar with COVID-19 symptoms, how it is spread, and when to seek medical assistance for a child. And again, you can see that there's an onus on you as the manager to ensure that your staff are made familiar with these types of things so that they can deal with it appropriately. So the additional controls for these then, what would they look like? So in terms of rotating the resources and not sharing the resources between different rooms or groups of children, staff are going to be made aware of this when planning the actual play program. That's something that you can talk about when you're actually sitting down to do the planning. An additional amount of time will be put in place, be allocated at the end of each session. There's a thing there that just to take into consideration that if you are going to allow additional time at the end of each session, there's a cost implication to that. You just need to be aware of that, obviously. Children's artwork will remain in the setting and not be taken home. Now that can be a big deal for children who just love to show off their artwork and whatever. But there is some evidence to show that COVID-19 can actually stay on cardboard and certain surfaces. So this is an additional precaution that you're taking. And one way you can do that, and to try and alleviate any anxiety from the child who really wants to take their artwork home, is to maybe take a photograph of the child and WhatsApp it to a parent or email it to a parent. So the child still gets the joy of letting mommy or daddy see, look what I did today, but you're keeping you're doing your bit to keep everybody safe. Where a child requires a toy from home, so the child that is anxious and has brought their own little toy in, to help them feel emotionally secure. An additional support is that you can support a child by cleaning the toy on arrival before it's actually brought into the playroom. So somebody brings in a Barbie, and what you can say there is, you can talk about the Barbie, you'd handle it very sensitively. We're going to wash our hands before we go into the playroom. Let's wash Barbie's hands too. And while you're washing Barbie's hands, you might have an antiseptic wipe there, and Barbie gets a top to tail wipe down before she's actually brought into the room. You do it in that way. You can make it playful for the child as well, just to help them not feel that they're doing anything bad. Outdoor activities will be increased. Again, your program planning will take account of that. And for staff to be familiar with COVID-19, the Childcare Partnerships training resource on COVID-19, that will be mandatory reading for all staff to ensure they are fully updated on the relevant aspects of signs, symptoms, and preventative measures. And the link to where you access that particular document on infection prevention and control, that is in the, there's a link to that in the guidance. And my understanding is that you will have to be familiar with that as part of the Health and Social Care Trust endorsing your actual reopening. I haven't gone into detail really on social distancing because the actual guidance contains some really good information on these issues. I'm trying to concentrate today on some of the issues that maybe aren't so obvious out there. It's vital that you plan for a scenario where a case of COVID-19 is suspected or arises, so that you and your staff know the protocol. It's a wee bit like safeguarding. Nobody ever wants to see a case of child protection raising its head. You have all these controls and plans in place so that if ever it does, that's your safety net. You know exactly what you're supposed to do should such a thing arise, and it's the same with this. You need to plan out what your protocols are, and again, there's good guidance in the actual version 4 of the guidance on page 14 and 15. That provides helpful details on what to do in those circumstances. And again, you want to apply that into your infectious diseases policy, what those measures are that you are going to take. Okay, so other points to consider then. I'll give you some thoughts that I've had on actual social distancing. So think about who needs to be on site and who doesn't. What is the minimum number of people that you can have on site and still be effective? Staff might only be on site when they need to be. For example, if the school age childcare doesn't start until 1:30 and your staff don't have to be there until that time, then they stay away until 1:30. You only have people on site as they need to be. Just remember that social distancing applies in your playroom, but also in your staff room, in your office, in your kitchen, when you're having staff meetings as well. You might want to consider having a staggered staff tea break or lunch break, for example. Certainly smoke breaks, if that's something that you normally manage. You're not going to have 2 or 3 people going out at once, because again, you have to ensure that social distancing is considered there. During staff meetings, you might want to control those in terms of maybe rearranging the seating to avoid face-to-face positions. Everyone brings their own notebook and pen because you're not sharing those resources. You might consider putting up printed posters. For example, in PlayBoard here at our kitchen table, there are A4 pages with the words "only 3 people at any one time" are actually sellotaped to the table. So you might do things like that, because as we go further into this situation and we do return to work, it's very easy then to become complacent. And those posters and that kind of thing will help to reinforce the message. Okay. So fee payments, do you normally take cash from your parents? Would you consider moving to a standing order or direct debit, perhaps to avoid handling cash and to eliminate face-to-face contact? Think about what you're going to do there. Maybe they could do that simply by a bank transfer on a date that you both agree. The arrival of staff and children. So again, it's that parents obviously are going to want to drop their children off. If you open at 8 o'clock in the morning and you have a host of parents there, how are you going to manage that? Are you going to give everybody a staggered arrival time, or are you going to have maybe set up the outdoor space so that there's a place for parents to wait while a member of staff comes out and actually takes the children from them? And the same with your actual staff team. Are you going to, you need to inform them of the fact that they shouldn't all be gathering around the door waiting to get in. As they are outside waiting to get in, again, they need to be looking on the social distancing compliance. Think of the gathering points, those common areas in your setting. For example, people might gather around the printer if they've sent stuff to print. They might gather around the photocopier, or again, as I've said before, there are smoke breaks. Your walk through the building will also help you take account of which of these areas might raise a bit of a red flag for you, where you need to put in additional measures. Some thoughts on cleaning. Again, the guidance notes, there's some really useful information in there, but just be aware that extra time will likely be required before or after each session. And again, you're going to have to agree that with your staff, because they may need to stay a little bit later. You may need to pay them a little bit later. What some settings are telling us that they're doing is potentially changing their time somewhat. So instead of running to 6:30, they're maybe running to 6 p.m. and then that last half hour they are using for the cleaning. Additional cleaning required if you share a play space and or resources. Again, if you have a play group in the morning and an after school in the afternoon, then you need to clean that room thoroughly after the play group use it, before your after school children come in. And again, after your after school children use it, because you need to have it clean for the play group coming in the morning. Consider again if you have sufficient and appropriate stock of cleaning, sanitizing supplies, and consider when you should reorder or replenish them. In the past here in PlayBoard, you know, we've done a run to B&M or Home Bargains, and you know, something that wasn't expensive in order to replenish our supplies. But obviously with everybody, and we have a team of 22 people here, even though only half are in the building at any one time, a lot more people are washing their hands more frequently, so you're going through supplies more. What we did was we actually appointed a supplier to come and deliver and replenish those supplies for us. You may need to consider again who is actually taking stock of what cleaning and sanitizing supplies you have. How are they going to be replenished? And what if the person who normally does the ordering goes off sick? Who's going to ensure that those stocks are reordered if that person isn't there? You don't want to run out of that, because, as I said, hand washing in particular is one of the key measures that we have in place to avoid the spread of COVID-19. How will you manage shared buildings? This is an issue that people have told us in terms of we use one room in a larger building. How do we do that if people can go in and out at night after we've cleaned? And the simplest way is you need to speak to whoever owns the building, and you need to arrange that space isn't going to be used. If you have a key, you lock the door, and it's as simple as that. No one's allowed in that actual space. But it is something that, depending on what your particular scenario is, you need to have a real detailed conversation about, to make sure that your staff are not having to do double the work because somebody has been in at night after you've cleaned and then you're coming in the next morning. And part of that is that part of your registration relies on you having all these things in place, and the guidance that you follow from the Department of Health says you should have the building clean. So you can use that as your leverage, if you like, in terms of whoever you're having those conversations with. A little bit of thought about transport. If you use vehicles, you have to treat your vehicle as you're doing with your premises. So your vehicles will have to be cleaned just as you're doing with the actual main play areas that you have in your building. So you might want to allow 10 or 15 minutes for cleaning before use. And you're going to provide antibacterial wipes. And if different staff are using it, then you might want to consider introducing maybe a checklist for staff, so that everybody is is on message and going through the actual checklist to make sure that the key areas here are cleaned. Because you're looking at handles, seat belts, indicators, steering wheels, seats, any surface that might have been touched, you need to wipe down. And if you've leather seats or whatever, the same goes for that. And you might want to also provide a hand sanitizer for your children before they actually get into the car. So you might want to carry those as well. Additionally, just on transport, because again, we're heading towards September now, August 24th, really whenever these schools are actually reopening. And you need to consider what you're actually going to do there for collections and pickups. And another little point to think about in that is that the school will likely have their own precautions in place. Department of Education, EA, have given them their own checklists and risk assessments that they have to do. So you need to find out from the school what they are. You need to know what their measures are that you will have to comply with if you are entering onto the school's estate. Ideally, there needs to be collaboration and partnership in place to do this effectively. And we know that there are conversations happening between Department of Health and DE in exploring how to align their guidance so that there's not a conflict between you going in to pick up the kids and the head teacher saying something else. But you do need to consider that, because yes, it's off-site as such, but it's somewhere that your staff are going to be. Some final thoughts. Okay, so you can't safeguard against COVID-19 100% due to the nature of how viruses spread. But you have to do all that you can to control the risk so that actual harm is unlikely. But you want to use balanced, reasonable measures. You want to use a common sense approach, because when you're doing risk assessments, you could be here to midnight. Literally, as you do one thing, you'll find the next. But so you want to look at the real significant points that come to mind. So what happens next? So you've developed the actual risk assessment. What happens after that? And we would recommend that you're going to share it with staff. Obviously, your staff are going to have to comply with it. So they need to know what's on it. And you need to find time to actually take them through it step by step so that they are absolutely 100% on message in terms of what their responsibility is in fulfilling those risk assessments. You want to share it with parents, because again, parents want to know, okay, I'm reasonably assured here that my child is safe in your care. I'm happy to let him return. Your local health and social care trust, obviously they need to see it before they approve your opening. And you need management committee approval, because again, the ultimate responsibility lies with them to ensure that a risk assessment is in place. There's no one size fits all really for a risk assessment, because everybody has different size premises, different permutations in terms of how they run their business. So it should be bespoke to your setting and your capabilities. And whatever you put into that risk assessment, you need to be able to achieve. Otherwise, what is the point in actually writing it? Don't just write it to keep social services happy. Make it a working document that you can actually achieve and obtain. So once you've shared it with your staff, your management committee, your parents, then maybe you're going to ask them, like, what do you think of this? And what you need to do then is incorporate any feedback. So if someone says, look, I don't think that's enough, or maybe you would like to think of, and then if they give you feedback on it, consider putting that in, because then it's potentially a more robust document that you have. You need to keep it visible and refer to it often. Don't put it away in a drawer. Don't do it just because you need a risk assessment in place to get social services endorsement. You have key tasks assigned and time frames on that document. You don't want to neglect any of the risks that you've identified. You put enough work into actually developing this risk assessment. You want to keep it somewhere that you and the staff can see it, and more importantly, be reminded of what you should be doing on a day-to-day basis. You need to review and update it. Have there been any changes announced by government, by Northern Ireland Executive, Department of Health, any new updated guides produced? if there has been, you need to incorporate whatever those changes are. And you've seen it's at the minute, it's like every month there's something new basically. In running your business, have there been any near misses that have occurred despite your best intentions to assess the risk and to put measures in place? What have those near misses been? Can you make any improvements as a result? And therefore you want to upgrade the risk assessment to reflect that. Basically, as changes occur, you need to update your risk assessment. And as you've all seen on the overhead notices on the motorways, work safe and save lives. And that's the whole intention of this. The whole intention is not to give you additional workload, which you definitely don't need, but it's to keep everyone actually safe. That's the main round of information that I'm going to give to you today. We are going to take questions. My colleague Pauline has been monitoring any questions that have come in. Before we actually get to those, we do have all your emails. So we will forward a handout of the slides that I've shared today to hopefully prompt your memory as you go away, because I'm aware that I've given you a lot of information today. So Pauline, perhaps you could let me know of any questions that have been raised. Here comes Pauline.
So
okay.
Is sand, water, Play-Doh allowed?
Sand, water, Play-Doh, it has to be, it's like anything else, it has to be risk assessed. You may do, one of the things that you may want to do is consider the little basin that you would wash your dishes in. You may want to have a little basin with some sand in it and a child's name on it, and it's put away. You've them stacked. And obviously you're going to want to replenish those for each of the children to actually, I think what the problem is, obviously it's a social distance measure there. If everybody's around a sand tray and everybody's hands are in the sand tray. So if each child has their own, that allows you then to separate them out without actually removing the joy that the children get from those particular areas.
How can we encourage children to share resources?
Okay, how can we encourage children to share resources? Again, there are books that are out there, and again, some of the links are on the guidance that shows you how to talk to children about COVID-19. So you need to do that sensitively and according to their actual age. And once you do that, then that kind of opens the door for you to introduce the concept of the children actually needing to share with each other. The fact that all those children are in the same room, the resources can be shared because you're keeping those children in there. That's a pod, so you when those children are in, that's your pod as such, whether it's 16, whether it's 24, whether it's 12. And so those resources have been okay to be shared amongst those children. At the end of the day, those resources and everything should be cleaned, everything wiped down and made clean for the next day. I don't think there are any more questions. If you do have them, please send them in. One of the other things that we will do, and even after you finish the webinar today, if you have particular questions you want an answer to, if you send it to us, we will ensure that it is put before officials at the Department of Health in order to get you the answers. I don't have the questions up on. But any that you do raise, as I say, we will put before them.
Any suggestions on collecting parental fees for parents who don't use internet?
Parents who don't. Well, most people tend to use internet. I would definitely try and encourage it, and I think if you give the rationale behind it to the fact that it is to protect the children, that might encourage them. One other way to do it is if a parent is to place their fees and whatever into an envelope, potentially you can quarantine that envelope for 24 hours or whatever it is. So when you've collected those and the name of the parents and everything's on it, you might find a space in the office to place that envelope with the fees, so that essentially you've given it 48 hours, whatever the case may be, as you think safe. I think it's 48 hours for cardboard is what the, bear with me, I should have a wee note on that somewhere. No, oh yeah. So they say plastic up to 72 hours, it can sit on, stainless steel up to 48 hours, cardboard up to 24 hours, copper up to 4 hours. So I would imagine that paper and cardboard would have a similar quarantine kind of time, but if you wanted to extend it to 48, that's potential way to handle fee payments if someone literally doesn't or cannot do internet banking for you. I haven't been given any other questions, so just while I'm waiting on Pauline to see if there's any more there, to alert you to next Tuesday, I'm assuming that most of you are here because you are preparing to open. And you are actually writing your risk assessment. I know some are here because they want to see if they can enhance the risk assessment that they've already done. But next Tuesday, the 18th of August at 11:30, we are going to run a webinar on reopening your childcare. So that'll go through more than what just the actual risk assessment here has taken on. And if you are interested in that, we would ask you to register interest by contacting my colleague, Maria Hammond, via email. Her email is maria.hammond, HAMMOND, at PlayBoard, PLAYBOARD.co.uk. Bear with me, Pauline's just giving me some other points here.
Can we send the slides?
Let me see this one.
That one there, just ask that one there. Apologies, me not took down. If there are any questions,
okay, yeah, okay. So some people are asking that if we can email them with any questions and anything else, and we will be able to do this for you.
Slides, can I have the slides?
Pardon?
Can I have the slides?
Yes, I sort of said I am going to email out the slides. And there's a couple of other little interesting documents that we have about playing after the pandemic and that type of thing, and we will add those in, because that question about the sand and the Play-Doh and that this will answer some of those questions for you as well. But if there are no other questions, then all it remains for me to do is to thank you for your participation today. I do hope that you got something out of it that will help you when you come to develop your own actual risk assessment. And do feel free to come back to us. You can phone me at PlayBoard on 90803-380 if you want to talk directly. Or, as I say, you can send us an email. But keep an eye on the inbox, and I will be sending you through the slides of what you've seen today. Thanks very much.